Okay, so I'm Dr. Luecken. I welcome you. I'm from Broadway Medical in Lynbrook, and we're an integrated medical practice. So what I'm going to be reviewing with you tonight is an integrated approach to new therapies, new technologies for the treatment of pain as it relates to accidents and injuries and what we call repetitive or cumulative stress syndromes. And it's really a very large topic. So I'm going to go through a lot of things with you. If you have any questions, I'll be glad to answer general questions after. And if you have any very specific questions or something that may pertain to you, then I will give you an opportunity to meet with me personally. I know you said this is more for your girlfriend, so. Okay, so I have an opportunity to give you a very personalized talk because I can see where the issues lie. So let me start with what this means, okay? Pain you understand, and when we have accidents or injuries or repetitive and cumulative stress on our bodies, it causes those joints to break down. So you saw on the other side of the board, I have an anatomy lecture for you where I will show you what happens when you have an accident, when you have an injury, when you are doing something repetitively that causes the stress or the strain or the sprain, and I'll explain what the differences are to you, accumulate or build up on the joints to cause a pain to develop. And then it can be simple or very complicated to get better. So let's start with that right now. So, again, accidents you understand, falls or injuries you understand, and we'll get into the strains and the sprains in just a second. Repetitive injuries have become very popular because we talk about typing on the computer too much, or I've had piano players. You see what's happening here with the ligaments and the tendons? I've had violinists come in because they practice like this for hours. Guitar players practice like this. So I make recommendations not just for the injury that's developed, but how to then prevent that injury from occurring. So for one guitar player, I said, listen, they make a stand that you can put the guitar on, and then you can stand and play the guitar without having to do this. One example. So that's the difference between what repetitive stress is and cumulative stress, although they're almost the same thing, except I'll tell you my personal history of cumulative injuries, which is cumulative stress. And what I'm also going to do is apply this not just to your physical injuries or anatomy, but I'm also going to apply it to how it affects you mentally and how repetitive or cumulative bad habits chemically cause the stress in your body to cause you to get sick and lead to disease also. So I'm actually going to broaden the lecture, and I think you'll get a lot out of it. And for some people, it really changes their lives when they understand. So let me get started with this main part of the talk. So when we talk about physical stress on the body, sitting there right now can be a stress on your body. And you may not be feeling it right this minute, but in an hour, let's see. Okay. So what happens is the pressure starts to build up, and the fatigue factor starts to build in that particular spot where the pressure is. And if your body, now here's the key to everything I'm going to tell you about good health. Your body has to always be able to compensate and adapt to every circumstance that you're putting it under. So your body is adapting to the temperature right now. Your body is adapting to my sound. Your body is adapting to sitting there. So you're adapting to the lights. Okay? So your body has to adapt. Now your body is also adapting to, which we'll get to in another few moments, if you had dinner. So your body is compensating for what you ate by making all sorts of chemical reactions in your body and hormones and etc. And if it does it successfully, you don't have a problem and you feel okay. But we'll get into what happens if it's not okay. Okay? So we're going to talk about that. So physical starts off as strains to the muscles, which I'll show you on the chart. And then it can lead to sprains, which is more of the ligaments and the tendons, which are the attachments. And then trauma, of course, is where your body cannot compensate and adapt for the overwhelming force that's being applied to it. So if you fall, or if you get into a car accident, that's what we call whiplash. Or, football players. So, this is where I tell my own little story, all right? So I happen to have a bad back and a bad neck. So why is that? And I'll tell you about my cumulative traumas. So, when I was about 4 years old, when I lived in Franklin Square, I was cleaning off my father's roof of his convertible. And I fell through the roof. So that was my first thing that I remember as a little jolt. Then when I was about 5, they were putting in the sewers in front of our house, and I fell into the big hole. And the policeman who lived across the street had to pull me out. Well, that was another fall, right? Then the next thing I remember was, and the reason why I actually became a chiropractor, is I was wrestling at Cary High School, wrestling on the wrestling team, and from having to bridge my neck, which is what you have to do so you don't lose the match when somebody's on top of you, I pinched a nerve in my neck. And it really hurt. And we happened to have a chiropractor living across the street from us, and I went there, and he took care of that pinched nerve for me. Okay. Then I had another experience, and let me back up. I had childhood asthma as a child, and I didn't play sports until I actually got into junior high school. So I always had a little weakness, but my family has weakness with asthma. And so I had a weakness there already, which I'm going to get to. And when I was about maybe 18 or so, I bent over to lift up the garage door like this, and I felt a stabbing knife go into my back there that I could not breathe. First the pain, and then I could not breathe. So it attacked that weakness in my spine there because of the attachments and me straining it from trying to lift. And again, I went to the chiropractor, and he alleviated that pinching, and I never had the problem. And I never had any asthma or breathing problems after that either. So, and then there's a little bit more of a story to it, because as a kid, before they built Cary High School, that was all fields.
Exactly.
And I was 4, 5, 6 years old, and I had terrible allergies because it was all goldenrod. That's why our street was Goldenrod Avenue, right?
Exactly.
So I had terrible allergies growing up. And when the chiropractor worked on my neck to alleviate the pinching, I had no more allergies. So I can remember going to high school with a box of tissues, and after that I never needed it again. So I've had personal experiences. Now that's only for me up to about that age. I also got one of these English racer bicycles for my birthday, and when I was about 17 or so, 16, before I got my car, and I was in the parking lot at Cary High School, and I wanted to see how fast I could go with that bike. And I hit a rock, and I went over and got knocked out, like that. And the fellow was there, he helped me over to the curb and whatever. And then I got a motorcycle when I was in college, and I was not going fast down a side street, but I got stunned because I thought the car was stopping in front of me, and I did not have to do the proper coordination of the handle grips, and my bike went over, and again, I was wearing a helmet, but like that.
Okay.
So that was another insult. You see how all these insults start to build up on your spine?
Yeah.
Then we were on Sunrise Highway, and I was with my girlfriend in my car, and my sister was behind us with her boyfriend, and it was rainy, and I stopped at the light, and he bumped into the back of us. So again, another whiplash. And then the worst one was one Christmas Eve, my wife and I went to visit her grandmother down in Inwood, and we were stopped at a red light on Christmas Eve, and a drunk hit us from behind, and hit us so hard that my glasses flew off my head and knocked my car into the side street. So that's enough to, really, that was the worst injury. Now, let me go all the way back to my back injury. When did my back injury start, my disc problem? When I was in 2nd grade at Washington Street School, I think I was late for school, and the 2nd grade class was down in the basement, so I was going down those big concrete steel steps, and I slipped and landed right on the edge of the step, right on my back here. And I saw stars, and I was crying and blah, blah. And I think that's when my back problem started. So you can see how all these jolts build up. And the reason why I tell you that is because as I develop this talk, I want you to understand how strains and sprains to your life, from your life, start to either be repetitive or cumulative. And we'll get to what that, again, in a second. So let me just show you this real quickly. This is the anatomy of the spine. I'm going to speak very quickly. So when the baby's in the womb, the baby's in a C curve. When the baby comes out, the first thing it does is it learns how to lift its head up, like this. And that forms the neck curve. And then the next thing the baby starts to do is starts to walk, and that forms the lower back curve. So in order to be balanced, when we look at you from the side view, you have a curve in your neck, a curve in your lower back, a reverse curve between your shoulder blades, and then you have a curve down here in your pelvis at the sacrum and the pelvis. So that gives you balance. 2 curves forwards, 2 curves backwards. Now when we look at you from the front, this is the front of the spine with your pelvis, and then this would be the back where you feel those little ridges. So this is supposed to be in alignment. You see that? That should be in alignment, but you should have curves like this to absorb shock and pressure and whatever. And the body is designed with these discs in between as shock absorbers, and also helps to maintain the posture. And then you have your movement back here. These are the joints right here, these 2 joints. Okay? So you have a 3-pronged stool. You got the disc in the front and the 2 discs in the back, and everything has to glide and move like that. Now, I'll teach you a little secret. The key to good health is being able to be flexible enough so that this can move any joint, your elbow, your shoulders, your hands, your knees, your hips, your pelvis, or your spine, all your shoulders, all your joints have to be able to move properly without restriction so that the water can get pumped back into the joint. So we call that rehydration, meaning fluid being pumped in, because the joints are 75% water. Your brain is 75% water, your body is at least 70% water, the discs are 80% water. Now, here's the key. If you get sprained and strained, and your spine from all of these things, has been knocked out of position like this, or curvature, scoliosis, whiplash, and you do not have proper flexibility, what we call range of motion, the proper motion, the body cannot pump the fluid back into the joints the way it's supposed to. Does that make sense? Mm-hmm. So, the more you're restricted in a joint, the less water is being pumped back into the joint, the faster that joint will start to dry out, what we call degenerate. And that's what we call a degenerated disc, when it's supposed to be plump, and now it's squished. So now when you start to develop that, I'm going to draw you some diagrams of how arthritis develops. Because arthritis is the compensation. Remember, the body will always try to compensate and adapt. So if your body has too much virus or bacteria in it, what happens? You get a fever. That's the body's way of trying to kill the virus and the bacteria. But what do? We try to block the body from having the fever because it's uncomfortable. In the meantime, it's trying to kill the virus and the bacteria. Okay, so, are you all with me so far?
So far.
Okay, so that's the physical part. And here's the little added extra I'm giving you all, because it's more than just accidents, injuries, and cumulative stress. But you can accumulate stress emotionally. So the more things get piled on you, taking care of your kids, taking care of your parents, work, worrying about money, having trouble with your husband or your wife, whatever stresses are accumulating on you. And then we have a study now that shows that you can only handle so much stress before you have an emotional breakdown. They say that if you accumulate 300 points of stress in a short period of time, it can cause a nervous breakdown. So what would 300 points be? Well, getting a divorce is 100 points. Losing your job is 80 points. All right? So you can very quickly, if a couple bad things happen to you, your mind can be very fragile due to accumulative stress mentally, and of course depression, because we know now that when you have stress, too much stress produces hormones, and those hormones can cause depression. So hormones can be good for you, but they can be bad also. So when we talk about pain can come from physical stresses, mental stress, because what happens when you get mentally stressed? You get tight, right? Don't you get tense? Well, the muscles are what are holding all your joints in place. So So now if your muscles start to go like this, you're going to start to have some problems. Now, chemical stress is harder to understand, but let me try to make it simple. Chemical stress, again, is when you are taking things into your body chemically, and your body is a series of chemical reactions, and the body has to be able to compensate and adapt and adjust and stay in balance. So when you have a blood test, it's supposed to be normal. If it's too high or it's too low, they say you have a problem, right? Your pH in your body shouldn't be too high, you shouldn't be acid, you shouldn't be alkaline. Now, it's the same thing with your conditions. I may be getting ahead of myself a little, but when you're normal, you do not have a condition. But if you can either have high blood pressure or you can have low blood pressure. You can either have constipation or you can have diarrhea. You can have a hyperthyroid or a hypothyroid, meaning overactive or underactive, right? So chemical stresses, when it overloads the body, will lead to these kinds of reactions, leading to asthma, allergies, cancer, because we know when the body's immune system drops due to the stress, it becomes susceptible. Diabetes. Now, let me explain diabetes, cirrhosis. You can tolerate a shot or two of alcohol. If you drink the whole bottle, what's it going to do to you? It can kill you. Why? Because those chemical reactions, that's overpowering the body so fast, the body cannot respond quickly enough within a couple hours, and it'll kill you. The same cirrhosis could take longer. You can keep drinking and drinking and drinking, but eventually, after 20 or 30 years, that organ is going to wear out prematurely. And now we find out that the same thing is happening with the pancreas with diabetes due to too much sugar and other foods, but primarily it's the sugar. And the reason why I say this is because it's stress. It's chemical stress on the body. Now again, if you take prescriptions, you could take 1 or 2 pills like you're supposed to. But if you take the whole bottle of pills, it's going to kill you. Again, you're overpowering the body. So, you can overpower the body with a car accident, or with a fall. You can overpower the body with losing your job and getting divorced and going bankrupt or whatever. And you can create chemical stress. And the body has to absorb all of these things. So it's not just physical. Now, we call that the onion peel theory. Okay? Because an onion starts off as a little kernel, and then it gets one leaf and another leaf and another leaf and another leaf. Those are layers of accumulated stress. And then you wonder why you could break down and get sick. So, what we want to try to do is see if we can't unpeel those layers of stress. So, let's look at the first sheet that I gave you. After that page there, the lecture page. The first thing I gave you is something that could save your life or somebody else's life. Because we just said that stress, emotional stress, can cause a heart attack, and we know heart attacks can also be caused by chemical reactions in the body. And if you read that very carefully and pass that along to your friends, that's a very simple technique that you can use for yourself or somebody else. If you can't give them CPR or you can't get CPR to yourself, they've got 10 seconds to institute taking a breath if they can, and then coughing real hard and repeating it every 2 seconds, and they will be inflating their lungs and expiring, and it's like doing the compressions on the chest. And this is something that's new. I had never heard about it, and I've been in practice for 30 years, but I included it in the last couple of weeks because I think it's so dramatic. So you read through that. That's a little extra that I'm giving to you that can really save your life or somebody else's as it relates to stress. Now let's go to the next page. All right, so the next page is just real quickly, I have included a sheet there of foods that are good for you, that will reduce inflammation in your body, and foods that are bad for you that will increase inflammation in your body. And the more inflammation you have, obviously the more pain you're going to have. Do you agree with that? Mm-hmm. Okay. Now the next page that I included is postural mechanics. It gives you an idea of the correct way to sit when you're working at the computer. And we call that correct postural mechanics. And in a few minutes, I'm going to review some other things that you can do for bending, lifting, twisting, so you're not straining and aggravating and causing these injuries to your body. All right? And then the page after that are some stretching exercises that you can do to alleviate the mechanical pressure and stress and strain that's building up on your body, especially when you're at work. And in a few minutes, I'm going to review some of the things that you should and should not do. Okay? So let's go to the next board here. Okay, so here's our little anatomy lesson. So as I said, this is one bone, this is the other bone, and it forms a joint. You always have to have two bones to form a joint, okay? The bones are lined with Teflon, which we call cartilage, and that's what allows the joints to glide, okay? But they will only glide if there's enough spacing left in the joint and the fluid can be in the joint to lubricate it. Now, holding your joint together is a ligament. Ligaments go from one bone to the other. So if you're getting arthritis in your fingers here and you know how they start to knob out, that's arthritis forming on the ligaments. I'll show that to you in a minute. So ligaments go from bone to hold that joint together to form a capsule. Okay? And then the fluid's in there. What moves your bones is your muscles. So your muscles move your bones or move the joint. You got me? Mm-hmm. Now, what attaches a muscle to the bone is the tendon. So you've heard of tendinitis? Mm-hmm. Okay. So when you eat a piece of chicken, you eat the meat, you know that hard rubbery piece at the end of the meat? That's the tendon. Mm-hmm. That's the part that attached that muscle to the bone. That hard rubbery. It's very hard. Mm-hmm. So when you aggravate these tendons that are very fibrous, or the tendon, they start to fray. Now again, what is the body going to do when it has an issue? It's going to compensate and adapt. So it can adapt two ways. It can either try to shift you to get the pressure off the bad spot, or you're not going to move your neck right? So you're not going to move as much, so now it's going to dry out even faster because you're going to restrict your motion, or you're going to try to compensate and move your arm or walk a little funny so that you don't aggravate yourself. And what happens is then, when that stress is constantly there, it's going to start to put down some arthritis. Here, here. Usually it starts at the attachments because that's where the greatest amount of pressure is, you understand? Wherever the greatest amount of pressure is, you're going to start to get, you may have heard of arthritic spurs. Well, the spur is the beginning of the cement being put down to try to anchor what's getting frayed, and you don't want it to pull away, or you're going to wind up having surgery. Once it's pulled away, it don't grow back. You can't. But if it's frayed, the body can still put a gritty toothpaste in there, which is arthritis. And then over time, that arthritis dries out and gets harder and harder and harder until it's harder than your bone. So this is what we call an arthritic spur. And on x-rays, the longer you've had the problem, the more this arthritis will start to form like this, until I see x-rays where the arthritis totally takes over to stabilize that joint because that ligament has been too badly damaged or weak. We're talking years, all right? So that's what arthritis is. Most people don't understand it. Most people think arthritis is your enemy because they think it hurts. Well, you know what? It's better than collapsing. It's better than, no movement. So that's the anatomy of a joint. Now, this is the anatomy of alignment. So we just talked about the alignment in the spine. So I like to use the car as an example. So if your car is in good wheel alignment, if the wheels are balanced, the car runs pretty nice and smoothly. But if you have a car with one wheel out of position, out of alignment, so it's driving like this, what happens? The car starts to shake, right? Well, guess what? That's what your body is doing when you're out of alignment and you're trying to walk and you don't realize it, but the shock is going from your feet all the way up your back. And if the shock when you walk cannot be absorbed by this proper positioning and alignment, but if you're like this and it's doing it, can you understand how that can cause grinding and can cause pain and pressure? So, when this happens, that constant grinding and irritation is going to lead to inflammation. And the inflammation also causes pain because inflammation allows swelling to occur. And the more swelling we get in the joints causes increased pressure, fluid pressure, and that increased fluid pressure then aggravates the little nerve endings, stretching them and putting pressure on them, so you get pain. So that's why you take aspirin or you take whatever to try to reduce the inflammation, or you try to block the pain signals. The problem with taking painkillers is you may be blocking the pain signal, but you don't know if you're doing more damage to the area. So we try to use natural anti-inflammatory along with corrective procedures, which is what we do. So that's why I give you that sheet just on the foods. You can reduce inflammation naturally by taking certain herbs, turmeric, ginger, and they're all listed there. And those are natural anti-inflammatories that you can eat and use every day to help your inflammation while you're working on trying to strengthen and correct the irritation from the mechanical point of view, which is what we specialize in. So let me review some of the postural mechanics now for you, so you can see how you can help yourself and not aggravate yourself. So I like to show you vacuum cleaning. So we're going to talk about how to alleviate these pressures on your pain on your neck and your back. So everybody vacuum cleans like this. All right, well that's not good for your back, okay? So you should vacuum clean like this. All right? And if you shovel snow, or someone you know shovels snow, you should not shovel snow like this, because you are not a steam shovel. See, that will tear your disc, your back out. So what you do is you go down, you pull it back close to your body, you stand up, then you stand to the side and you dump. It's a couple extra steps, but it can prevent you from winding up in the hospital or months and months of rehabilitation therapy for a bulging or herniated disc. Now it's the same with lifting packages out of the car or lifting a child. When you have to lift, you get as close to the playpen or as close to the car for the packages. You try to brace your knees if you can. You lean over, you pull the package or the baby or the child is close to you, and then you grab them and pull them close to your body, not out here. Again, that's that fulcrum problem. You're not a steam shovel. Always think as an elevator. You go up and down this way, not this way. That's critical, because you can only understand you're changing the centrifugal pressure on the discs, and you're doing this when you should be doing this. This is what's right, and that's no good, because you're squeezing the disc like a balloon and forcing it back. So that's lifting. So even washing and brushing your face and your teeth, you get as close to the sink as you can and brace your knees, and then you lean forwards, bracing against it, and then it doesn't hurt. But if you're doing this, even just washing dishes for a half an hour, whatever it takes, if you can bend your knees a little and brace, it takes all the stress away, because your muscles are picking up the tension, not your back joints and the disc. Now sitting. The best type of sitting is in a firm and higher chair, not a lower and softer cushiony one, because it doesn't give your muscles anything to give support against. If it spreads out, it causes you a problem. So the best thing to do is to sit like this, and then when you're uncomfortable, you start to cross your legs like this. I do it the wrong way. This is not good, because what it's doing is it's turning your hip out. And if you're sitting like this, you're turning your hip in. So the best thing to do, especially if you're having an issue, is to cross your legs. So you're still staying neutral, and you're just crossing your legs. Now, getting up, you should try to get to the edge of the seat, or if you're in a car, swing around, get to the edge, hold on here, and you put your feet like this, so it's the pressure your supports underneath here, and you try to come straight up without banging your head on the car, but in a chair, or slide to the edge so you can get your feet directly underneath, balance yourself on something, and you come straight up. Again, the elevator. As soon as you do this, you're straining yourself. And it's cumulative strain that leads to these problems. Okay? Now, one more thing that's extremely important when we talk about this, and that's reaching. We talked about bending. Now let's talk about reaching when you're cleaning blinds and reaching in the cupboard or whatever, or painting. You want to work at a comfortable level like this, so there's no strain here. As soon as you start to do this, or you start to do this, you're getting yourself in trouble. And I'm not talking about falling, but I'm talking about straining all of these muscles trying to compensate. And I'm not even holding anything. There's not even any weight involved. You add weight and it just multiplies the amount of physical stress on the body. So always try to work at a comfortable level. Get up on a stepladder. The extra few moments that it takes to adjust yourself on the ladder, so you're painting or arranging the cupboard or working on the drapes or vacuum cleaning or whatever, can save you from a fall and serious strain. Because you never know from your other stresses and strains when something's going to let go. And then you get the pinched nerve. These muscles are holding you in place like this. Think of them like a Christmas tree. And you've got your big muscles and you've got little tiny muscles. A lot of them. And they all have to work together. Every time you're moving, they're all adjusting. It's amazing. If one of them goes into spasm, it throws everything out of whack. And that's when your body will go into spasm. Or you'll start to develop a kink like that, and that'll lead to a pinched nerve. Now, let's talk about how we treat these things. Okay, so now once we've got this, we do what we call an integrated approach to treating this. So the simple way is when you're first getting a pain is to rest. A simple strain or sprain, we say RICE. Elevate the joint, I'm sorry, that's not elevate. Rest is R. RICE. Rest, elevate the joint if you can. All right? You put ice on it because it's going to be inflamed when it first hurts. Don't put heat on it because heat will create more swelling. And you don't want more pressure because that creates more pain. So you use ice for 10, 15, or 20 minutes depending on how much meat you got in between. If you're putting it back here, you can do it 15, 20 minutes. If you're putting it on something closer to the bone and you're much more sensitive, do it for 10 or 15 minutes. I remember when my elbow swelled up, I didn't even feel the ice. It was so inflamed. So the more you don't feel the ice compared to the good spot, the worse it's inflamed. And when you're starting to feel the cold after a couple of days, then you know the swelling is going away. And then, once it feels more normal, then you can switch over to heat to stimulate circulation for healing. But you don't want that in the beginning. So remember RICE when you get hurt. Rest, ice, compression is C. Compression, put a bandage on it to keep the swelling from blowing up. And then E is the elevation, again, so that it'll drain, so that the swelling will drain. RICE. All right? Okay. So that's the first thing. All right? The next thing we do is then we try to encourage some exercising or some movement to try to get the flexibility back. Now, if it's still hurting, then you need to get some help because then it's not correcting itself. So our bodies do self-correct every day, and when you sleep at night, there are minor corrections. But if you've stressed yourself too much or if it's too long because it's either repetitive or cumulative or it's been due to an accident and injury and it just overwhelmed the body or knocked it out of whack too much, then you need some help from someone like us. So we will encourage the exercise. Sometimes we'll give you supports, again, for the compression. Then we use the physical therapies, and the physical therapies are either to try to increase the flexibility or reduce the swelling or increase the circulation. reduce the muscle spasm. That's why you use the electrical stimulation or the ultrasound or the hot packs or the ice. Okay, that's physical therapy. Exercise falls under that category. And then there's the postural alignment. Now, the postural alignment you can't do anything for if you haven't been able to do it. So that's where we come in, and this is where these new technologies are so much more effective than the old way, and I'm going to show them to you. But I always like to include people being conscious of their feet. I'm wearing orthotics right now. So if you have flat feet, or if you know that when you walk you do not have a normal gait, it's very important to have your feet evaluated for orthotics to try to balance out a twisted pelvis that could have happened in childbirth, or a fall, or strains, or too much sitting, or weak muscles, or whatever happened. But if you've got some kind of distortion like this, you see what happens to my knees? And you see the feet? Well, it can be coming from the feet too. So it can come from the pelvis, or it can come from the feet. But either way, you got to get your wheel alignment straightened out. So I always like to make people aware, because most people don't even think about that. And that's why orthotics are important, and we always incorporate that or evaluate that. Now, if people are having a serious issue, like a pinched nerve, or arthritis in there that's causing pinching, and there are a number of issues that can cause it. But if you know that you've lost your alignment, or that you're getting pain, like pain going down your arm, pins and needles or numbness, pain down your leg, pins and needles and numbness and burning, weakness, then you're getting a pinched nerve. And so we have some new technology. So I gave you the pamphlet. Look at the pamphlet, because I have the pictures in the pamphlet. I don't have any other pictures. So in our office brochure, I incorporated these two new technologies. This first technology is called decompression of the discs. So the lady that's laying on the table, do you see that? Mm-hmm. All right, she's strapped into that with a harness, and she's laying there, and if she has a disc problem or pinched nerves that are going down either from her neck or her leg, then the machine goes like this. It's programmed based on her weight, and it stretches very slowly over a minute, holds it, and then it contracts very slowly. So what it's doing is it's pumping the fluid, it's pumping out the swelling and pumping in the good fluid. It's stretching out the muscle spasms. It's loosening up what we call the fixation or the tightness in the joints. And it's opening up the joint space where the nerve is coming out. And the main thing is when you separate it this way, you're sucking the disc back in this way. So if somebody has a bulging or herniated disc, and the disc is bulging out because of this abnormal pressure and a tear in the disc, then by separating it this way, it sucks it back in this way. That's how this works. So it's a fancy form of traction. We don't just put somebody in traction and leave them there for 3 days anymore. What we do is we work it. So it pumps out the swelling, pumps in the good fluid, relaxes the back spasms, opens up the joint where the nerve is being pinched, and helps to retract or pull back in the disc that is bulging out abnormally or herniated even. All right? Think of a tube of toothpaste. If you squeeze a tube of toothpaste, it starts to bulge out. If you squeeze too hard and it squirts out, you're never going to get it back in that surgery. But if you can relieve that pressure on the tube of toothpaste, like by letting go and you suck that back in, then you've made a correction. So that's what the decompression therapy is. And the newest one that I'm the most excited about is this pulsed hand-guided instrument or computerized spinal and joint manipulation. So as a chiropractor for 30 years, of course, I used my hands and I did hand manipulation on the back or the neck or whatever joints were pinched. Knees, hips, feet, wrists, carpal tunnel. And of course what we did is we went in there and we moved it with our hands, laying down or adjusting them like this, or laying them on their side and going like this. But now, and if you like, I have these pamphlets here. Now we use an instrument like this in the hand. It's hooked up to a computer. And what it does, and this is amazing, we can now go in and it does two things. First, it'll analyze, and then it can be used for the treatment. So it'll go in there, that prong will go in there like this and send a little impulse in like this. And what it's doing is it's measuring the flexibility of that joint. So you'll see the bar graphs. So what it does is I can either do the neck or the mid-back or the lower back, and it'll compare this bone to this bone to this bone on a bar graph. So when I send a message in, it bounces back out again through the computer analysis, and it comes out as a bar, like this. Now I do the next vertebra, and if it's normal and the same, it's going to come out the same. Now if I hit this thing and it doesn't move at all because it's either arthritic or too much muscle spasm, it's too stiff, then when I send the impulse in, it's going to bounce out hard. You see that? Now if it's swollen from a disc, and I send that impulse in, it's going to be too mushy. It's going to absorb that impulse, and I'm going to get a low bar like this. So now I do an analysis on that, and it's a little more, you'll see the waveforms also, so I can do an analysis of waveforms. How is that impulse going in, and how is it coming back out again? So that's normal, but if it's like this, it's not normal. And if the other one is like this, then that's not normal either. Hi.
How are you?
Good. Thanks for coming.
Sure, why not?
So we can analyze that now with the computer, and then the computer will automatically calculate, comparing one bone to the other, what is it going to take to help to loosen that up. So it automatically calculates it, and then we go back in with that handheld, where did I put it? Then we just simply place this back on the joint, and the computer will automatically go like this until that starts to loosen up like the other vertebra, and then you've made a correction. And there's another screen on there where you can actually see the treatment happening. Each impulse is being recorded in a strip graph, and when it comes down and it levels out, then that means that's all you have to do. The machine shuts off automatically. So it automatically calculates what does the bad spot need to be like the good spot. And then there's another program in there called trigger point therapy. Do you know what that is? When you have pain in muscles and joints, it gives off, there are spots where the nerve endings give off toxic, I don't want to get too complicated, but they're called trigger points. And that machine will do treatments on those trigger points, and you can treat specific conditions like TMJ or carpal tunnel, or the hips or the back, or sciatic, which is the nerve pain, or the muscles going up causing headaches. So there are specific programs in the computer for those specific points based on the same concept. So this is the new modern technology that we're using to try to treat these conditions more successfully.